like, share, subscribe News and press bell icon below for upcoming news.
Around half of U.S. counties, representing 70% of people in the United States, fall into a low or medium risk category, according to a new COVID-19 community metrics tool trusted source released February 25 by the Centers for Disease Control and Prevention, CDC. The new tool provides county-level guidance based on coronavirus cases in the community, COVID-19 hospitalizations, and hospital capacity. As the virus continues to circulate in our communities, we must focus our metrics beyond just cases in the community and direct our efforts towards protecting people at high risk for severe illness and preventing COVID-19 from overwhelming our hospitals and our healthcare systems, CDC Director Dr. Rochelle P. Walensky said February 25 in a media briefing trusted source. Because the new framework is based on regularly updated data, it will allow people to ease up on mask wearing and other precautions when the community risk is low and dial them up again as the risk increases, Walensky said. Please click at the link below if looking for best weight loss and immunity boosting supplement. In areas deemed low risk, where there is a low level of severe disease and limited impact on the healthcare system, the CDC does not recommend widespread mask use. Medium-risk areas have a greater number of severe cases in the community and some impact on the healthcare system. In these counties, the CDC recommends people with an increased risk of severe illness talk with a healthcare professional about whether they should wear a mask or take extra precautions. In high-risk areas, where there is a high level of severe disease and the potential for significant impact on the healthcare system, the agency recommends everyone to wear a mask in public indoor settings. The same metrics apply to both the community and school settings. The CDC continues to recommend people in all areas stay up to date with their COVID-19 vaccines, including getting boosted if eligible. Walensky emphasized that any person can choose to wear a mask at any time based on their preference, regardless of the community risk level. Please remember that there are people who remain at higher risk for COVID-19 and who may need additional protection, she said. Those who are immunocompromised or have underlying health conditions, those who have disabilities, or those who live with people who are at risk. People whose personal risk from COVID-19 is low can help protect those who are more vulnerable by wearing a mask in indoor public settings. In addition, the agency recommends trusted source that people with symptoms of COVID-19, a positive COVID-19 test result, or exposure to someone who is positive for COVID-19 wear a mask when around others. The CDC's recommendation that people wear masks on public transportation will remain in place for now. The new tool focuses only on mask use in communities and school settings. The new tool represents a shift in how the federal government is approaching COVID-19 guidance, as the Omicron surge winds down. The agency's previous method was based primarily on COVID-19 case counts. Using that method, the majority of the country has substantial or high transmission, which would warrant people wearing a mask in indoor public settings. However, during the Omicron wave, the large surge in cases did not translate into an equally large impact on hospitals as seen in previous waves, although many healthcare systems were still strained by the sheer number of hospitalizations. The new method focuses more on COVID-19 hospitalizations and hospital capacity. It also takes into account community cases of coronavirus infection, although the agency has set a higher threshold for what level is concerning. Data for these three metrics will come from hospitals and public health laboratories. Walensky said this data is updated regularly and is available in most counties. The COVID-19 community level tool will be updated weekly. Walensky said communities, businesses, and schools can also use other metrics on top of this tool to assist them in making decisions about COVID-19 risk and when to recommend masking and other mitigation measures. This might include COVID-19 wastewater surveillance, vaccination rates, and equity issues, such as how many people are in an at-risk population. The new risk tool does not specifically take into account a community's vaccination status. So, two counties with a similar number of cases and hospital statistics, but with widely different vaccination rates, would fall under the same risk category. Walensky said while vaccination rates are not built into the tool, they do play a role in determining how many people end up in the hospital with severe COVID-19. Low vaccination rates can translate into higher COVID-19 hospitalizations. Our most recent data have demonstrated that if you're boosted, you're 97 times less likely to die of COVID than if you're unvaccinated, she said. Thank you for watching this video. Please like, share and subscribe this channel for updated news. Please visit the link in description below if looking for weight loss and immunity boosting health supplement. Have a nice time.